exactly is first aid? Well, by definition, it is the emergency care or treatment given to an ill or injured person before regular medical aid can be obtained. First aid can be used to treat something small like a minor abrasion. Sometimes you will be administering first aid to a more severe injury. Nonetheless, keep calm and do your best to keep the injured person calm as well. First aid can be applied at home and in the workplace. Knowing what to do makes all the difference. Let's start with the basics. Before anything, you must know where all the first aid kits are located in your home or business. Knowing where the first aid kit is may seem simple, but it is often overlooked. Once you locate the first aid kit, next you need to know what type of injury you are dealing with to provide the correct treatment. Let's start with one of the most common types of injuries, cuts and abrasions. Cuts can be painful but usually not life-threatening. If you happen to have a cut, put the injury under warm water, clean with antibacterial soap, and make sure to just clean around the area. Do not get any soap in the actual cut. After you have washed the injury, pat the area dry. Next, apply a medicated gel meant for cuts and abrasions. Lastly, apply a clean Band-Aid, and that cut will heal in no time. If it is a larger cut that is bleeding heavily, first apply a clean piece of gauze to the wound. If it bleeds through the gauze, simply place another one on top and apply pressure. Keep doing this until the bleeding stops. Next, apply a clean bandage to the injury and wrap it up. Be sure to redress this injury as needed to keep it clean. If you cannot get the bleeding to stop, call 911 immediately for medical assistance. Some diseases can be transmitted through blood, so if you're going to treat someone's open wound injury, make sure you're wearing proper PPE. At minimum, you should wear gloves to avoid contact with someone else's blood. It's usually obvious when you are unable to treat a severe wound. If you have concern that you can't treat the injured area, call 911 for assistance. Burns can also be painful, but again, usually not life-threatening. If you do receive a minor burn, the first thing you can do is put it under room temperature water to ease the pain. Never put a burn in cold water. Next, apply a burn treatment ointment, such as aloe vera or any other burn treatment product. Sometimes the burn will blister. If it does, do not pop the blister. Let it heal naturally. If it happens to pop, do not peel the skin away. Leave it as is and clean the wound. First, rinse the wound and then apply antibiotic cream. Lastly, cover it with gauze and replace with new bandages as necessary. As with all injuries, if the burn is severe, please call 911 for assistance immediately. Another common injury is an eye injury. Anytime you get something in your eye, it's important to remember not to rub it. Rubbing the eye can result in more severe damage. The eye will naturally defend the intrusion with tears. Let the tears flush away the foreign debris. Heavy, quick blinking will help this process. If the debris will not clear, rinsing with water or eye solution is the next step. You may have an emergency eye wash station nearby. Don't be afraid to use it. If you still cannot clear the debris, see a doctor or medical professional. When cleaning windows or mirrors, it is best to spray the cleaning solution into the towel versus onto the glass. Spraying directly onto the glass allows for that solution to get into your eyes. If a chemical does enter your eyes, the first thing to remember is keep your eyes open. When you close your eyes, it keeps the chemicals in there. Keep your eyes open and flush them out. Go to the nearest eye wash station or water source. Hold your eye open and flush the area. Rinse for at least 10 minutes. If needed, don't hesitate to reach out for medical assistance. If you get a larger object lodged in your eye, such as a wood chip, do not remove the object. Call 911 immediately to receive emergency medical services. Removing the object yourself can lead to permanent damage. Heat stroke is another serious condition. When we sweat, it helps keep our bodies cool, but we also lose a lot of water and electrolytes in the process. Once we lose enough, our body will go through the first stage of heat exhaustion. You will feel dizzy, nauseated, and may have a headache. You may be sweating excessively or have clammy skin and hands. If you do not take steps to prevent heat exhaustion, you will have a heat stroke. Drink cool water or liquid with electrolytes. If you haven't already, make sure to take off any jackets or outerwear. Apply a cool rag to your face. Heat stroke occurs when you stop sweating and your temperature increases to a dangerous level. The victim may be fatigued and confused. Their skin will be burning hot and dry. If severe, they may even have seizures. If you think anyone is having a heat stroke, call for medical attention immediately. Keep them cool and wait for help to arrive. Blunt trauma can cause a person to go into shock. This is beyond first aid, and you will need to call for medical emergency services immediately. If the person does go into shock, help them lay down on the ground and raise their legs slightly using an object. Try to keep them calm until help arrives. Choking is another serious life-threatening condition. You may need to take immediate steps to save the person's life. If you see someone choking, you must remove the blockage to prevent them from suffocating. Have someone call 911 for medical assistance immediately. If you are the only person there, you must take immediate action even before calling for help. Support their chest with your arm and bend them over at the waist. With an open palm, hit their back between the shoulder blades hard multiple times to try to dislodge the object. If that does not remove it, you must go behind them and perform the Heimlich maneuver. Wrap your arms around their waist and make a fist with one hand. Place the fist above the belly button. Grab your fist with the other hand. Pull hard and lift up at the same time to try to dislodge the object. If you are alone, you can try and perform this on yourself as well. Have we covered everything you might encounter regarding injuries? Of course not. It is up to you to evaluate each and every situation to make the best decision possible. Knowing the location of first aid kits and other medical supplies is the first step in first aid attention. Be alert and ready to react in any situation. For any severe injuries, don't hesitate to call 911 for emergency medical services. Thanks for watching and have a safe day.